the topic of our lecture, modern professional oral hygiene in pediatric dentistry. We can speak today about the modern oral hygiene and oral hygiene in home and at dentist and dental clinic. Oral hygiene. What we need to know about oral hygiene. This set of study methods, the state of oral cavity and hygienic measures carried out in the oral cavity and aimed at preventing dental diseases. We know about individual oral hygiene and professional oral hygiene. You can see the pictures, and all of you knows about the good oral hygiene helps us to enjoy our life. And we can speak, we can taste, chew, we can swallow delicious and nutrition foods, and of course we can show our feelings through facial expressions such as smiling. And if we can protect our oral health with good oral hygiene practices, yes, then we can keep our teeth for a lifetime. And individual oral hygiene, of course, it is as different steps, yes, of individual therapeutic and preventive measures, which we carry out with the help of personal oral hygiene products. Oral hygiene individual, based on a prevention program and consists of daily hygiene preventive procedures. Okay, individual oral hygiene. Yes, we need to brush the teeth and to keep teeth healthy. It's very important to remove all plaque, sticky, colorless, and colorless film of bacteria. Plaque build up can cause tooth decay and gum diseases. And even teeth that already have fillings are at risk for tooth decay. Plaque can build up underneath a chipped filling and cause new decay. And if there are areas in the mouth where gums have pulled away from the teeth, so we called this disease such as gum recession. The exposed tooth roots can decay as well, and dental plaque is hard to see. We can see it more easily if we stain it. After the brushing the teeth, we can use special disclosing tablets, which we can buy in the drugstore, or brush with a special disclosing toothpaste. The color will show still this plaque on the teeth, or we brush them very well and remove it. Then brushing tips. Yes, what we can use, and a few words about the professional oral hygiene. It is a system of therapeutic and preventive measures. When we work in the dental chair and doing special medical procedures and preventing the oral diseases. Professional hygiene includes, first of all, it is professional teeth cleaning. The second, patient motivation, yeah. Then individual selection of oral hygiene products and items, and patient training in individual oral hygiene. So when we have the step that control teeth cleaning. And the main activities, so we can decide it into the three groups. First group, it is preventive. Of course, it is examination of the patient. Then when we calculate the indexes of oral hygiene, then caries prevention measures. For example, it is cleaning the teeth, fissure. 1 minute. When we're doing our hermetization, yeah, sealing our teeth. And periodontal diseases with the removal of over and subgingival dental plaque using the special equipment. Next one, educational. When we do information of knowledge about the anatomical and physiological features of the oral cavity organs, about personal oral hygiene products and training the rules of their use.
Sorry, doctor. My internet at my building, there's no electricity. I have to go to a cafe in order to join.
Okay. We start, and some part, the first part you can see later. Okay. Then development of individual programs for hygienic prevention of major dental diseases, and the third type, it is treatment and preventive. Of course, here we need to think about periodontal diseases, about implantation, and different rehabilitation measures in the post-operative period. So here we can include anti-inflammatory therapy, physiotherapeutic treatment, and clinical examination. Of course, we need to do treatment of hyperesthesia of hard tissues if patient has these problems, deep fluoridation, and of course today, in this step we need to do selective grinding teeth. Okay, dental plaque. It is an accumulation of microorganisms and products of their vital activity on tooth surfaces. Formed by adsorption on the surface of the tooth enamel of microorganisms from oral fluid due to specific glue-like water-insoluble polysaccharides and dextrans, as well as specific proteins of saliva. First of all, it is biofilm, yeah, oral biofilms, dental biofilms, and peri-implant biofilms. And you can see a picture. For biofilm formation, it is necessarily bacterial, liquid, and surface. Formation, of course, we remember about the microorganisms, about the streptococcus, about the Neisseria, yeah, Veillonella, and different microorganisms that lives in the oral cavity. Stages of dental biofilm formation. Guys, attention please, because this question will be in your tests on our practical lessons, and when you will have preparation for the croc. Stage first, it is formation of the cell-free organic film on the surface of the enamel, which we called pellicle. Yeah. From 1 to 10 microns and from several minutes to several hours. It is stage first, from several minutes to several hours. The second stage, it is adsorption or adhesion. On the surface of the pellicula of proteins, microorganisms, and epithelial cells. Colonization of the matrix by microorganisms that from microbial complexes. And this stage can be during the last several days. The third stage, beta formation of mature biofilm, so up to 30 days. Look, please. What about the structure of mature biofilm? Of course, it is colonies of bacteria, matrix, conductive channels, and pellicula of the tooth. Consist of microorganisms up to 70%. Of course, this question you will have when you will write your tests. And intercellular matrix, complex of glycosaminoglycans proteins. It has a mesh structure inside. So the first stage of dental calculus, when we have the production of organic acids, the pH of the medium increases and leads to the accumulation of calcium and a deposition in the form. What methods of removing mineralized deposits we know? Of course, it is manual and rotational instruments, mechanical. We can use sound or ultrasonic, chemical, and combined. Of course, for manual method, we can use curettes and scalers. Curettes, you can see a different form of the work part and different size. And it is ultrasonic scaler. Curette Gracie and type 9 type here. Ultrasonic scaler. Yes, if you remember the previous semester, when we have preparation for the lesson, I told you about the special about the manual procedures, yes, with these instruments, and we speak about the different sizes of the work part, yes, of course, about the different form, and we work when we have under gingival, for example, calculus, we need to have very hard work. So when you hear about that professional hygiene is very simple procedure, is not true, because sometimes if patient have a big deposits, many calculus, it's not very simple procedure, and we need to work near the gums, and if we touch our gums with these instruments, we can have a trauma. And system of vector, I remember the time when it be the very good instruments and very modern and vector by only good clinics. But nowadays, I know that we don't use it very often because it's very difficult to position the teeth near the root. And vector works such as round. It's very difficult. So benefits ultrasound method: work speed, less trauma, strengthening the action of medicinal substances, and effective cleaning of the teeth. And disadvantages: causes aerosol cloud formation, piezoelectric scalar, and magnetic restrictive scalar. Removal tools and non-mineralized deposits. We can use air abrasive system. Remember the airflow and different types of powder. We have three types of powder. First of all, it is carbonate natrium, the second carbonate calcium, and glycine. In pediatric dentistry, we can use carbonate calcium and glycine. Then rotary instruments, rubber caps and circular brushes. And preventive professional paste, it can be different varieties of degrees of dispersion. And this paste may contain fluoride and can be without fluoride. Floss tips and superfloss. Modern methods, air powder processing. First, it is airflow, and the second, Perio-Flow. For the first time, the air abrasive technique was used in 1945 as a method preparing the cavity before filling. And airflow, it is appropriate devices and powders for processing the surface of tooth crowns. We used only in supragingival area. Perio-Flow we can use only in subgingival areas to remove biofilms. These different methods, because Perio-Flow we can use when patient, for example, has diseases, but airflow we also can use when patient have gum diseases, but we need to take the glycine. Okay, not abrasive powder. Then, what we need? Water, air, and abrasive powder. And look, please, for the angle of the work part. It's very necessary. We don't use it near the gums. Okay. And indication for airflow, of course, this destruction of the subgingival biofilm. This method can give us removal of pigmented plaque. Then decontamination of periodontal pockets, cleaning the implant surfaces. Then patient desire to lighten the teeth, but not chemically using breaching methods. Contraindication, of course, when patient, we don't use it when patient have non-nelated diet. Then with severe forms of respiratory diseases, with infection diseases and pregnant women. And availability herpes viral. And types of the flow. This carbonate natrium, very abrasive, and different types of airflow, different companies, So China's not enough settled volume nozzles, water and powder feeds, which will lead to increased trauma. And air profi unit. It's very simple. Ergonomics of work when subgingival processing nozzle directed on the surface of the tooth at angle of 10 to 90 degrees. And in this time, we have dependent of the powder. We move the nozzle in a circle above the equator of the tooth in the semicircle in the cervical region. Perio-Flow, company EMS and ENSCA. The Perio-Flow technique, we can work in shallow pockets up to 4 millimeters and treatment deep pockets from 5 to 9 millimeters. Then Excel tradition methods of ultrasound and manual scaler for biofilm removal. And maximum effective and comfortable for the patient to use the stages of supported periodontal therapy. When processing of subgingival area, the nozzle is directed on the surface of the tooth root and moving nozzle up and down with a step of 1 millimeter along the entire perimeter of the tooth root. Okay, and here you can see a small picture about the angles, sorry. Then powder type. Bicarbonate-based natrium, its particle size up to 250, and it's not toxic, soluble in water for removal of biofilm and very pigmented plaque stains. This powder is traumatic for cement and may contribute to greater exposure of tubular dentin. And different examples of this powder. Pearls, it is carbonate net calcium. Has round particle shape. It's very good for enamel, for dentin, and for removal of biofilm, of course, pigmented plaque and stains. But more safe and effective on enamel and traumatic for cement. Can contribute to great exposure of the dental tubules. And this type of powder. And working angle with calcium bicarbonate powder natrium. So the close the angle in the 90 degrees, so perpendicular to more damaged surfaces can be applied. So not near the gums or, for example, down angle, but we need to work only is to 90 degrees, okay? And glycine, small particle size up to 45, and it's maximum effective to destroy biofilm. Safe and automatic for enamel, for cement, and for dentin. Also less traumatic for ceramic and composite restoration, and safe for periodontal tissues and subgingival processing. And examples also. Erythritol. Look please to this slide. It is chemical neutral sweetener. And part size 14. It's level abrasiveness more than glycine. And working angle at subgingival powder processing paste and glycine. So look please. the work angle. Powder application, choose enamel, carbonate calcium, bicarbonate natrium, and glycine, and erythritol. Root choose glycine and erythritol, composite restoration glycine, ceramics carbonate calcium glycine, titanium zirconium, it is also glycine, and braces carbonate calcium and glycine. It is special table when we table when we then you can see this slide. So when this powder's effectiveness, okay, and when we work under the gums, when we don't work. So under the gums, we can't work with carbonate natrium. Okay, and don't remove the deposits, erythritol, glycine, and bicarbonate natrium. Okay. Next one, the particle structure of powders under a microscope. So it is bicarbonate natrium, and it is glycine. Basic rules of work: always work with water flow. And depending on the powder selected, use the correct positioning of angle. And we need to choose powder is conformity with the procedure surfaces. When subgingival processing, the nozzle is located at a distance of 3 to 5 millimeters from the surfaces, and always we make movements with the nozzle. So when subgingival processing, movement in the circle or in the semicircle, when subgingival up, down movements with a step of 1 millimeters. And what advantages and disadvantages of air powder system we have? So benefits: effective biofilms removal, maximum patient comfort, reduction working time, access to hard to reach places, and treatment implants and braces directly in the mouth. It's very useful. And disadvantages: it is large aerosol cloud, risk development of emphysema if we work with airflow and walk near the tongue. Some patient has emphysema, so it's very necessarily when you use airflow. And impossibility use acid in patient with chronic or destructive lung diseases, for example, bronchial asthma, during an exacerbation. Professional hygiene of children, the terms of age from 3 old, we use brush, circular area, rubber cups, and abrasive paste. RDA in this paste need to be from 30 to 50. Then from 4 years old, abrasive method using glycine-based powder, brush, cups, and paste. From 10, we use calcium bicarbonate. Yes, calcium bicarbonate, brushes, cups, and paste. And from 12 years, also calcium bicarbonate, powder, brush, cups, and paste. And chemical agent, you can see the examples. It is soft gels that contain natural polysaccharides and acids. And when we use it, we detect the plaque. Two surface polishing, so it is special cups with toothpaste and brushes, brushes. We can work without the water, for example, 20-30 seconds, and then we need to wash the teeth. Protection of the polished tooth surface, of course, it is fluoridation method. And as the example, we can speak about the bifluoride 12. It is deep fluoridation method, so we also need the different and the special curves of our manipulation, and such material as the multifluoride. Here you can see the varnish with different tastes. The result of professional hygiene, the child 7 years old, and we can paint it our teeth. All painted areas, it is biofilm, it is our microorganisms, and after the professional hygiene. Thank you for your attention, guys, and next you will have this video in YouTube, and we give you a small video about the professional hygiene. And today our lesson is over, first lesson, and second lesson we will have a small break, okay? And then we will speak about the pregnancy woman.